People coming out of so-called mental health treatment can face some really unique and really significant challenges. And in my opinion, there generally isn't really good support for them. So when I was a teenager, I was basically forced into so-called mental health treatment. And it took me a really long time to kind of grasp the truth of the experience and what it means in the context of the larger mental health system, and also how to heal from it and how to kind of recover my full potential and develop myself fully afterwards. And so I wanted to share some of the things that I've learned, hopefully so that others don't have to reinvent the wheel. Just a quick disclaimer here. This is not professional advice of any kind, and this is certainly not mental health advice. So this is strictly for informational purposes only. The core idea that I want to emphasize here is that in a lot of mental health treatment, a core aspect of what happens is basically loss of self or suppression of the self. And this is especially true when it's youth mental health treatment, but it's certainly relevant to people of all ages, or it can be. This is the core idea of the book Asylums by Irving Goffman, which was written in the 1950s, primarily about people in mental health treatment facilities. That these institutions likely mean loss of the self and a really potent attack on the self. And that it, to use his words, likely involve acute psychological stress. And this is very interesting because mental health treatment is supposed to be good for you. But if it involves this attack on the self, which also involves acute psychological stress and therefore causes trauma, then it's clearly not good for you. But of course, it's very unlikely that anybody around you is going to own this or be accountable for it or validate your experience of it in any way. Now, why is there this tremendous loss of self? Well, I would say that it really comes down to something that is a core feature of mental health treatment in general, whether it's you seeing a therapist once a week or less, or it's with you living at a place, or it's being forced to spend time at a facility. Loss of self happens because there's this extreme power imbalance where you have one class of people, the people either working at a facility, or they're the mental health professionals there, or it's the therapist you're choosing to see. And then you have another class of person, which is you. And you are the one who is at the bottom and is basically powerless. And just that very dynamic is itself often very harmful. Now, there are many different ways that this can play out. A big one is that if at any point you do try to claim your own power and autonomy and agency, which is, of course, the source of your own healthiness and well-being probably, they can just pathologize it. And they can just use this as evidence saying that you're unwell. And basically, they'll only deem you as improving or getting better or doing well if you are abandoning all of that and you really accept this very subjugated, dehumanized position under them. This is certainly what I experienced and saw when I was in so-called mental health treatment as a kid. And so compliance is a huge aspect of what they expect. I wrote an article going into this in detail on my website. I'll put a link to it in the description. And so the stress that you feel as a result of this suppression of the self can often be interpreted by the mental health professionals, or I should say, can be misinterpreted by the mental health professionals as just another part of your pathology. Because they're probably not going to own what they and their profession are bringing to the situation. And so again, they're going to misuse their power when it comes to interpreting what is going on for you. And this just kind of creates more and more layers of brainwashing, of manipulation, whatever you want to call it. And a related part of the previous point is that it's typically difficult, if not impossible, to disagree with these mental health professionals, particularly if we are living at a facility like a rehab or something like that. And the reason is because they're always evaluating you, right? They're always judging you. And so if you disagree with them in any kind of significant way, they can just say that you're unwell and potentially keep you there longer. Another really significant thing that can happen is that mental health professionals who are basically this authority over our lives and our minds can interpret the situations that we're in and the various circumstances of our lives in a way that is completely wrong. And the problem is, because they have all this power over us, and because they are the default authority over sense making of these areas, they can then basically cause us to kind of really radically lose our perspective and basically force us to lose touch with the reality and the truth of our lives. And obviously this can be devastating. So as an example from my own life, when I was a teenager, I was basically non-compliant in my environment in various ways and for various reasons. One was because I was trapped in a dysfunctional family system, which I perceived as being very painful. And I really just kind of refused to go along with the dysfunctional dynamic in various ways. And I was kind of proud of it on some level, actually. And another was I just really wasn't agreeing with the school system, because I thought then, and I continue to think, that the school system is very broken and our method of modern education is highly problematic. And so then I get to mental health treatment, so-called mental health treatment, as a teenager, and the clinicians there, who are, part of my care team, basically totally deny all of this. And there's no acknowledgement of this. And when I speak about it, that is seen as evidence of my pathology more. So basically the problem is that, the reason why I was non-compliant with my environment has to do with some other kind of unnamed pathology within me. One of the programs that I went to said that it was because I had immaturity disorder. So they use these various concepts and things as a way of basically denying the truth of our situation. And this can happen in all kinds of different ways, where basically the mental health professionals will be on this expert pedestal, and then the way that they interpret our lives and the kind of thinking that they impart and really impose onto us is something that really kind of warps us and really causes us to lose touch with who we are in a really big way. Now, when I've talked about this previously in various areas, some people will say to me, wow, that should not happen. If a mental health professional is doing that, they are not trained properly. And I've thought about this, and I actually don't think that it's an issue of training. I think that it really has to do with structural factors in the mental health profession, which is that you have, again, this expert authority, which has tremendous power. And it has tremendous power because we've set up this kind of technocratic system where society gives them all this power. We say, you are trained properly, you have the skills necessary, and now you get to have this power and this authority. But you have that in an area that is A, totally subjective or almost entirely subjective, and B, involves tremendous human vulnerability. And so I think it's that combination that really comes from the structural conditions of the field. That's what leads to something like this. And I really don't think it's so much an issue of the individual therapists in general or their training. Now, that's of course not to say that individuals can't make the situation better or worse. I totally think that individual mental health professionals really can do a lot to avoid these issues, to create an experience for the patient that is better. But still, I think nobody can fully outrun these structural issues. Now, when you actually live at a facility like a rehab or a residential treatment center or a so-called therapeutic boarding school or even a mental hospital or anything of that nature, the situation can get a lot more complicated and a lot more damaging very fast. Now, of course, a lot of these issues still apply even just with basic therapy. But the situation, I think, is a lot more terrifying when you live there. And a lot of it has to do with the surveillance, the constant surveillance and the constant evaluation. So normally in our lives, right, like there might be an authority who is evaluating us and judging us from time to time, but they're not doing that for 100% of our lives. And they also don't like have access to our thoughts. They can't be like, oh, what are you thinking? And then you have to answer, right? Or they can't like read your journals, which is something that happens at a lot of these places. So when you have that kind of power and that kind of power that sort of demands a level of insight into, just deep into your inner world, that becomes scary in a way that is really just, it's really hard to put into words. And there's a lot of rhetoric that comes from the mental health field and I think is very much kind of seeped into our society at this point, which basically denies a lot of this and negates it and basically says like, oh no, for example, we've been trained in person-centered therapy and it's very humanistic and all of that. And I think we just need a little reality check here, right? Because it's like, let's say you're in this extreme power dynamic, you're there non-consensually, or at least many aspects of it are non-consensual. You're undergoing constant surveillance. It's extremely coercive. Does that sound humanistic to you? And so I think we really need to learn to kind of see beyond the veil and see beyond a lot of the rhetoric and spin. And so what do we do coming out of this? That's the key question, right? How do we heal? How do we develop our full potential coming out of this? Well, given mental health treatment to a significant degree involves this loss of self, this attack on who we are, this diminishment of our own power and self-determination, it's really about reclaiming all of that. And that is a long and challenging, though very rewarding process, which just kind of accumulates and consolidates over time. And a really big aspect of that is really about getting back into your own body. And that's really challenging because we might have had to leave our body because things were so painful, right? So if you go through this kind of thing, obviously it's excruciating. And so getting back into that, it's something that we kind of have to ease back into and we sort of have to do at our own pace. And the other thing about that is that doing that can kind of represent a significant departure from the culture that we're in. So take, for example, the culture of these programs. The people in there the people working there are not embodied, integrated, whole, self-aware people. If they were, they wouldn't be working there because they would be in touch with the trauma and the pain that they're actually causing. And so that's kind of the cool thing about this is that as we then start to do this work, we then kind of leapfrog them and we sort of evolve to a new place, to a higher place that might be significantly different from the culture at large, and certainly the culture that we have been trapped in. And I think a lot of the dynamics that we go through here are not that different from other authoritarian systems in general, like many family systems, like many schools, and arguably the school system in general, like religious systems, political systems, etc. And due to their repressive nature, These are environments that suppress the self, that that inhibit the development of authenticity, that get in the way of the development of our full potential in all ways, in terms of, physically, you could say, in terms of our health, in terms of our mental and emotional well-being, our creativity. So these are just some of my thoughts on this issue of what to do coming out of mental health treatment, how to make sense of the situation. And so I hope that this has been helpful for you. Again, my goal is to just share some of what I've learned so that other people don't have to reinvent the wheel, assuming, of course, that it is applicable to their experience. So I hope that you've enjoyed this. Please consider sharing this video with anybody who you think might find it valuable. Please also subscribe to the channel if you haven't done so already, because I'm going to be having a lot more videos that touch on topics like this in the future. Thank you for watching this, and I look forward to having you for the next one.